Today we are joined by the Hutto Police Department's Community Crisis Response team, and we are excited to kind of learn about what they're going to be talking about today. We know that a lot of you might already be involved in the mental health space, but we hope that today will give you some talking points or conversation starters, potentially new perspectives, in regards to how we can better serve the community around us. So joining us are Kassy and Ashley from the Hutto Police Department. They will be speaking to us about the Hutto Police Department's groundbreaking approach to better serve the community and the mental health needs of the residents within Hutto. So without further ado, I will pass it to Kassy.
Thank you, Cody. Good morning, everybody. Afternoon, my apologies. Today we're going to talk about building bridges between law enforcement and mental health. So my name is Katia, I go by Kassy. I have a background in psychology. I'm currently doing my LMFT, and I have worked in crisis for the past 4 years. I work in different areas with the mobile crisis outreach team, Burnett County and Williamson County. I also assisted at the Youth Therapeutic Respite Center as a coordinator, and I have done multiple trauma-informed care certifications as well as other things to assist law enforcement officers in mental health and crisis.
And I'm Ashley. I am new to the team. I've been here about 6 months, but I do have a background. My education is in sociology, criminal justice. I have a bachelor's degree in sociology and a minor in criminal justice. I've been working in crisis intervention for the past 5+ years. I was working previously with Bluebonnet Trails as the crisis intervention through their mobile outreach team. Previously worked as a telecommunicator for Williamson County, have several other certifications in suicide prevention and crisis intervention.
Hi, so we started this initiative in Hutto in 2024. We started the program as a crisis response team, and we saw a huge need. So we started developing a plan. How can we make this program bigger and better for the community? And how can we serve also those people who are dealing with mental health in a better capacity? So in 2024, at the end, we submitted another role for the city to approve, and that's where Ashley came into services. So as a crisis intervention specialist. And now we are in the last stages of the program. We call it the program development stage. We're actually seeing about 2 years that this is going to take us so we can have a full-on unit that we can serve the community and those people in mental health services. And we're going to talk about what we do in this program a little bit further.
So our objectives today is to engage and inform y'all about our crisis response team. You'll learn kind of the definition standards related to crisis response, some of the most prevalent calls our citizens are dealing with, most mental illnesses that they're dealing with, our strategies for interacting with them in crisis, how we assess and respond to those, and the roles and responsibilities of our team. So our goal is just to build a better understanding and support for our crisis intervention efforts in Hutto. So the big thing that we get from a lot of our officers is, why do we have to deal with these mental health calls? And so I think it's important to realize the reason we're here is due to deinstitutionalization. So process of moving people out of our state hospitals and out into the community. And unfortunately, by doing that, there's not a lot of resources in the community. We're not built to handle all these law enforcement calls. And so that transition has led to an increase in the interactions between law enforcement and our individuals with mental illness, resulting in arrests and involvement in the criminal justice system. So they brought us in to kind of help alleviate some of that and maybe keep some of those people out of jail and connect them into community resources.
So some of the things that we do, we correspond with officers when they encounter a situation where a individual is experiencing a crisis. We assist with an assessment for potential causes of the crisis and see where can they take this person, or what approach can we take. We also assist with training, and we also serve as a community liaison for the Hutto Police Department crisis response team. and we collaborate with other hospitals and community partners in assisting them understand our role, and also how can we help them and help the community connect with these people. One of the big things is that we help officers with training as CAT, crisis intervention training, or MHO, which is the mental health officer training. And this is just to better serve the community when somebody is experiencing a mental health crisis. We know that anybody can experience one, so being prepared, it's one of the main things that we want to do. We want to be proactive and not reactive when it comes to crisis.
So why bother, right? These stats are a little bit old, and I think that it's going to be even bigger when new stats are coming out. But we have almost 4 million adults in Texas that are living with a mental illness currently. And 754,000 of those had serious thoughts of suicide in the past year, and 61% needed mental health treatment in last year but didn't receive any. So some of the barriers that we see are financial barriers, right? There's stigmas for mental health, and there's all kinds of issues that are preventing a lot of these people from getting any kind of mental health treatment.
So one of the things,
sorry, go ahead.
Go ahead. So one of the things that what is a mental illness, right? We often get asked this question. So we try to put in what the American Psychiatric Association states, that a mental illness is a condition involving changes in emotions, thinking, or behavior. I like to say it is anything that takes you out of your norm. We have like the best version of me, right? And then a crisis happens, and then that's going to affect the way I act or I react or my emotions or what kind of behaviors I display into this. And this is where the crisis come into play. It also associates with like other distress like house, social or work or family activities or different environments that we get attached to it. And that's why I say like everybody can be in a crisis at some point in our lives. And that's why being proactive into this topic, it's very important.
So, what is a crisis? According to NAMI, it's any situation in which a person's behavior puts them at risk of hurting themselves or others, prevents them from being able to care for themselves or function effectively in the community. And a crisis for me could be completely different for you. So, we try to keep in mind that when we're going out to people, something that may not faze me is definitely going to be an issue for somebody else. So there's a couple different types of mental illness that we are seeing in our community that are most prevalent. We have psychosis. So I know a lot of us have some mental health background, but it's those distorted, unusual experiences. We're paranoid, hearing voices, unrealistic thoughts, and feeling pursued by others. A lot of our clients we're seeing dealing with schizophrenia. It's a big issue when it comes to psychosis. Another one big for us is mood disorders, depression, bipolar, manic depression. A lot of generalized anxiety disorders are a big issue as well. The last one that we're seeing too is substance abuse. We have a lot of issues with alcohol use, especially in Hutto. And so it's really connecting those people to resources, because that's one of the most deadly things that they can come off. So we want to make sure that they do that safely, but it can lead to paranoia, anxiety, severe depression for those folks. So there's a lot, kind of what we talked about with deinstitutionalization, mental illness in the society and the person. It can lead to a lot of barriers. Kassy, will you go to the next one? So sometimes there's consequences that affect life and our community as a whole. So we are experiencing things like homelessness and Hutto, poverty, unemployment that impact our economy, productivity, and healthcare costs. And those mental health problems can also trickle down into our juveniles. So they're having difficulty succeeding in school, family issues, and just overall affecting their well-being and the community's well-being.
So what do we do with the officers? And this is how we handle a call, right? So when the call gets dispatched, the officers, of course, they go and clear the scene, make sure that everybody's safe. And then they call us. Once we arrive, we assist with a mental health assessment. We usually do the Columbia assessment for crisis. And then we can dictate from there that this person is able to remain safe in the community. We provide resources, we call providers, we help them get connected with services and do the whole 9 yards run with them. Or if they're not able to, then we go the emergency detention route and we tell the officers what we have. Most of the time the officers are like, no, they need to go on an emergency detention because we can see them. Our officers are very well trained into this. So if they go on an emergency detention, we assist the officers with finding a bed, transportation with the officers, and then we follow up with the individuals afterwards to also make sure that they're connected and they have all the services that they need to be successful in life.
So what are some of the options that we're dealing with when we're out there with our officers and, with our citizens? We're looking at options of inpatient, whether they want to voluntarily go or if we are putting them under an emergency detention and having them get inpatient treatment. Some of the other options we can do are safety plans, and usually those are verbal, where we're able to come up with ideas, whether that's coping skills, putting up things to help keep them safe, having family with them as well. We do have some additional community resources that we have connections with, whether that's therapy, local mental health authority, intensive outpatient, partial hospitalization programs. And then a key part of our program is the follow-ups that we do for our clients afterwards.
So the emergency detention order, this is something that we wanted to provide some information on because not a lot of people know what an emergency detention is. So the emergency detention allows the officers to assist these individuals who are in crisis and take them to the best facility that they can receive treatment. And it lasts up to 48 hours for these individuals to receive treatment. Once they are placed on emergency detention, they have to be seen by somebody within 12 hours. So it kind of like allows this individual to receive treatment in a faster way, especially for those who are deteriorating or they're in a psychosis type of crisis. So it mandates this on the Texas Health and Safety Code, Chapter 573, that the officer can put these individuals in an emergency detention order. However, there's some guidelines that they have to meet. For instance, they have to have a reason to believe and do believe that this person is experiencing a mental illness, and they're in a substantial risk for them to themselves or other people, and there's like an imminent threat to restrain these people, and there's no sufficient time to obtain a mental health warrant to take this person into custody. So based on this, right, they can put these individuals on an emergency detention order and then take them to a hospital. And some of the hospitals that we can, if the person is in crisis, right, and an imminent threat to themselves or others, then we connect with our community partners to make sure that they have a bed. And we kind of like I mentioned at the beginning, we're the liaison, so we also communicate with the hospitals to see what kind of treatment do they provide, so we can see what kind of hospitals would they be better off if we take them there, because we know that some hospitals provide more substance abuse treatment than others, or they're specified on women, right? They have a lot of services for females, so that's one of the things that we do.
So some of our hospitals in the areas that we're looking at, we're in Hutto. So we have some that are close: Rock Springs, Georgetown Behavioral, Canyon Creek, and Cedar Crest are a little bit north of us. But then we have Austin Oaks and Cross Creek. And so we have great relationships with all the liaisons there. And so if we have issues or concerns or questions, we're able to reach out, make sure that it's the appropriate place to send that person and that they're going to get the services that they need. We also have the local mental health authority, which is in Williamson County, which is Bluebonnet Trails. In Travis County, you're going to have Integral Care, but Bluebonnet Trails is great for helping us with funding. They also have a diversion center program to where they're able to accept our clients that are on emergency detentions who don't have insurance. And so they go there and get the same kind of treatment, and Bluebonnet Trails is able to provide funding if needed to a hospital like Georgetown Behavioral or Rock Springs. Bluebonnet Trails is also a great resource if they're not going inpatient. They do have psychiatry services case management services, respite services for those who don't have insurance or underinsured. So there is a lot of resources that we're able to utilize through them. So our follow-ups are pretty important to us. We try to follow up every 14 and 30 days. We ensure that if we have referred that client to Bluebonnet Trails or an outside resource, that they're able to do that. And if not, that's something we can either go out to their house and do that, or we can do that by phone, providing those referrals to community programs and services. We're able to provide it to the family. If they're not taken into a hospital or anything like that, we just want to ensure that they're getting what they need. If they do go into hospital, we like to follow up afterwards, make sure that they're stable. If there's nothing else that they need, that they're still able to get medications and things. And if not, we can send them to the correct people who can help them with that.
So these are some of the data that we provide. As you guys can see, we've seen an increase in calls. So this is only the calls that we get through 911 and that are in imminent crisis that people are calling. This is not the calls that they place to 988 or the crisis hotline. This is only the calls that get routed to our officers. Last month in July, we had a 58 call note. And right now we're seeing also an increase in August already of all the calls. So there's definitely a need of this. There's also a need for crisis response teams out in the community because we see in the numbers, right? The numbers don't lie. And I have a mixed relationship with data, but it's definitely an increase from last year into this year. We had a 41% increase in calls. Thankfully, we have had no suicides. And we corresponded with law enforcement officers 17 times. So a lot of these calls, they come at night. And our shift are only go all the way to 9 p.m. So most of these calls, they will come between 9 and 7 a.m. So that's the times that we're not able to correspond with officers. However, we do provide assistance over the phone to them.
So our goal currently for Hutto Police Department is to make sure that all of our officers by the end of this year are equipped with the knowledge and resources to handle these mental health calls. So we are working on putting them through the mental health officer training. We are doing pretty good, and we only have about 20 more or so that need it, but we are getting there, and we're making sure that they have the resources that they need. Some of the qualifications to take this class is actually that they need crisis intervention training, de-escalation. So in getting their mental health officer training, they also have those already. And so it's kind of the final thing that they need to really provide for our citizens. So the Hutto Police Department has recognized the need for enhanced mental health support. I mean, if you've seen our data, it's definitely we're getting higher and higher call volumes. And so they have made a dedication to providing mental health to the community and mental health support. So we've taken a proactive initiative to reflect this and supporting residents during their times of need, the impact of their efforts during the time, but also promoting safety and well-being of the entire community. And officers are equipped to provide the essential support, fostering a safer environment, making a meaningful difference in the lives of the people that they serve.
Like we talked about, we also do a lot of community engagement to let know the city that we're here represented. This is the second year that we do a mental health resource fair where we invite all the community partners to come and interact with the community. It's a free event. We just ask for them to bring a lot of resources for the community from their establishments. And we have done, this is the second year that we do a proclamation for mental health awareness. We're about to do a suicide prevention proclamation for the month of September. So we're very proactive. We want the community to see mental health as a need, right? Like we are here to support the individuals in crisis and not to get rid of the stigma. We know that there's still, even in 2025, there's a lot of stigma around crisis and mental health. And we are here to support those individuals who are in crisis and to educate the individuals in the community who still thinks that mental illness doesn't exist. We have had a lot of conversations about that. And I think the more that we are out there, the more that we engage with the community, the more that we pass proclamations and we talk with city council, the better that we're gonna do. But it's definitely a team effort.
So one of the things we wanted to quickly touch base on was some case studies that we had. I had a recent call from one of our officers who called me when I was working until about 9, asking for a resource guide from us because we try to have little booklets that we hand out to our officers. He reported that he was flagged down by a citizen who was actually a veteran who had been recently discharged from the Marines. He reported that he was pretty tearful, but a pretty flat affect, and that he was struggling and wanted to get him a resource guide. And so I encouraged the officer to have, let me talk to him. So I met him out there and found out that this gentleman had actually put a gun in his mouth and was wanting to complete suicide. He said he stopped because of his family, and he was open to getting mental health treatment. As we all know, the VA system can be frustrating, and his appointment was in October. This was, I believe, in June. And so I knew that he needed to get some help. So we went ahead and did that emergency detention. That way he couldn't leave the hospital if he got scared, because it's a whole new environment for him. And so we got him that help. And last month I actually checked in on him, and he reported going inpatient was the best thing that could have happened to him. He was able to get into a great program at Rock Springs. It's called the Heroes Program. It's made for law enforcement and veterans. And so he was able to talk to fellow veterans, to psychiatrists, to therapists, and work through some of the things that he saw while he was deployed, and losing some friends and working through that. And so he said going inpatient was great. He was able to get back home to California and is now connected into the VA. And so he expressed appreciation for everything that we did to listen, to hear him out, and to get him the help that he needed.
And I would like to tell you guys about one of my cases that I've been working since last year. So I've been dealing with this family since last year, providing resources and providing assistance and services to them, helping them get connected. But as we know, mental health, you have to be willing to participate in treatment, right? You want to have the change. Even if everything is given to you, you're the only one that can put the time and effort into this, even if you get all these resources around you. So I was dealing with this teenager whose parents were extremely involved in her life, and she just didn't want to. She didn't want to take medication. She didn't want to go in services. She didn't want to do anything, right? She keeps saying that her parents were the reason why she was like this, and it wasn't her. And it was a constant battle between parents and them and us and other community resources. Up until about 3 months ago, she assaulted mom, and had to be taken into custody. So while at the juvenile center, we were able to connect with services at the juvenile center and connect with Bluebonnet Trails and do an urgent appointment, all the resources and services that we have been trying for her to connect. She finally said yes. So once she got out of there, we got an urgent appointment. She received services. She got an intake services appointment, and she was able to receive services through Youth YCOT, which is youth services for MCOT, but for youth. And now she is doing good. She's going through her appointments. She's thriving. She's in school again. She wasn't in school up until last year. The medication is still a little iffy. She still doesn't want to take it every so often, but she's better. She has a case manager who has been providing services and supports to the family and has been helping them navigate the system. So that was for the longest time not a very successful case up until 3 months ago, but it took her wanting to participate and receive the services that we wanted to provide to her. So right now she's thriving. We actually talk about this case in another conference because she was not a success case. until recently. So we're very excited for her, and we're going to continue providing follow-ups to the family and services for them to be the best version that they can be.